Hello everyone, Dr. James here. Today we're going to cover passive range of motion. Though it is an overall simple concept, it can sometimes be difficult to initially understand. Passive range of motion is the use of an external force, such as my hand, that moves a joint, my elbow, through its available range of motion without any muscle contractions. We all understand that a joint either flexes or extends. Therefore, complete flexion and extension is that joint's total range of motion. This type of therapy is extremely important for your dog's knee after surgery. If the joint stays in one position for too long, the limb can lose its flexibility. The joint capsule will begin to harden. The joint fluid loses its viscosity. And this increased stiffness can lead to a slower return in activity and even walking. The benefits of passive range of motion are that it improves the joint motion after surgery. It also prevents joint contracture. It prevents the soft tissue inflexibility and shortening that occurs. And it also prevents adhesions between the soft tissue and the bones, and again enhances the overall joint lubrication. Now that we understand the benefits of range of motion, let's learn how to do it on your dog. It definitely helps to have two people when performing this therapy. Therefore, we asked Nikki, our promising vet student for the summer, to assist us today. It's extremely important to be sure that your dog is both comfortable and relaxed while performing this exercise. Now, although passive range of motion can be performed while the dog is standing, it's generally more relaxing and beneficial to do it while the dog is lying on its side. It's also very important to be very gentle and to not force anything and create pain or discomfort. Now, technically, the textbook way of performing passive range of motion would be to isolate and focus on one joint at the time, such as on the knee. I would support the knee below the joint, support the knee above the joint, and then go through flexion and extension gently. Most of the time though, this is far more time consuming, and often we can accomplish and get the same benefits by doing the simple bicycling technique. Holding your dog's leg below the hock, which is here, we'd simply bicycle the leg in a walking fashion, such as this. In doing so, we're interacting with the hip joint, the knee joint, and the hock all at the same time. Now ideally, we would want to perform this at least 20 to 30 times a day, and if you notice any signs of pain or discomfort, you want to stop the exercise and probably call your veterinarian as soon as possible and see if you might need to adjust your pain management protocol. Once your dog is weight bearing on the leg, you can stop the passive range of motion and focus on some of the other strengthening exercises that we covered. That's it for today. Have a great day.